Hi, I'm Jimmy Lyions. I wanted to make this video just to go over one of the surgeries that I often do for wrist pain or pain at the base of your thumb. This is something that we do quite frequently, and if you're watching this, you're probably one of the people that have this problem and potentially even signed up for this surgery. What it is usually pain at the base of the thumb here, and it a lot of times can radiate around and cause a lot of dull, aching pain. And it's usually pain with like gripping or pinching activities. And when it gets bad enough, it really can just hurt all the time. We call this the CMC joint or carpal metacarpal joint of the thumb. And on this, it's represented by, here's your thumb. It's this bone right here that typically, or this joint right here, that is the problem, and it becomes very arthritic for people. I'll show you on an x-ray here in just a little bit. But essentially for this, we usually start off with some bracing, like a brace or some anti-inflammatories. Sometimes we'll use a steroid injection to help calm the pain down. Eventually, if these things are not offering you the satisfaction that you need, or it's still affecting your quality of life or your ability to use the hand, well, then we will move on to surgery. This surgery that we would perform for this is called a Burton's arthroplasty, or at least that's the version that I use. And it's an outpatient surgery, so you do go home the same day. The recovery period is a little bit different for everybody, like most surgeries, but in general, I would say you go home the same day of surgery. Initially, I have you in a splint that immobilizes your thumb pretty significantly. You really don't use the hand a whole lot for the first 10 days or so. Then I have you come back for your first post-operative appointment, and at that point, I put you in a Velcro splint. I take you out of this plaster splint and put you in something that's removable, and we start moving the wrist around, moving the thumb around. And you can use the hand at that point for light activities. So you're really only one-handed, or don't have the ability to use that hand for about 10 days or so. And then at that point, you can start to use it a little bit. But we still avoid for the first 5 to 6 weeks any heavy pinching or gripping of things that would stress the base of your thumb joint. And then after about 6 weeks, we will start working on more strengthening. So you can imagine that if you have a job that you do manual labor, you're really not getting back to that job for probably somewhere between, most time, 3 months. But for everyday tasks and that sort of thing, you're really using it pretty quickly. We do utilize hand therapy for this, and so we will have you see a hand therapist to help you get stronger. Vast majority of people will end up doing therapy. Occasionally someone will just say they'll want to do things on their own, but I do think most of the time people do better with therapy. That's to start off. I think the overall recovery is probably, for a lot of everybody's different, but I think it can go all the way out to even 9 months, close to a year. But by all means, you're functioning and living life. It becomes stronger, your stamina on the hand becomes better, and any little achiness might improve. But a lot of times people are feeling pretty darn good, even as soon as 3 months out or even a little bit sooner. All right, here I wanted to show you an example of the wrist brace that you'll be on once you come back after surgery. So you'll be putting this on about 10 days or so. Your first post-op appointment, we will transition to this. This is a wrist splint that does have a extension that immobilizes the thumb. And this is what I'll have you wear for the most part for the first 5 or 6 weeks. And you'll come out of it occasionally for some range of motion exercises, or if you're showering, or if you just want to take a break, do some scar massage to the area. But in large part, you'll wear this throughout the day and even even the nighttime. And then we'll transition out of it as we go further along. But it's nice because you can take it on and off. It really just will slide on. Your thumb comes through here, and then you have these Velcro straps that you can tighten to make it snug and fit you, appropriately. And it kind of immobilizes, but it leaves your fingers pretty free. And I still would be fine with you, gently doing things, using the hand to drive, or being two-handed in the kitchen. So you're not one-handed for very long. Obviously, there is some discomfort there that stops you from being able to use the hand as well. The other thing is at the time of surgery for pain control, because this surgery can hurt right afterwards, but we do different things to help the pain by obviously medication, different modalities, anti-inflammatories such as ibuprofen. We do use some narcotics, but we try to limit those as much as possible. And then also the anesthesia team will give you typically a pain block, and they'll start off by just kind of numbing up your arm, and then they slowly will feed in some medication over the course of 3 to 5 days that really helps control your pain very well. And then there will be instructions on this as far as what to do with it and how to return it and that sort of thing later. But this is one of the tools we use at the time of surgery. So just wanted you to know that they will be giving you a pain block, and this is one of the things you'll go home with. All right, here I just wanted to go over an x-ray and what we're typically looking for this type of problem. And also I'll kind of explain more of what we do for the surgery. So here you can see this is obviously the wrist. These are the carpal bones. And typically you can see throughout the wrist there is a very nice line that is filled with cartilage that is smooth and it doesn't indicate that, or indicates a very healthy wrist joint. But as I come out here at the base of the thumb, you can see here there's no space between these two bones. And it's essentially bone on bone, what we call bone on bone arthritis. So you should have nice cartilage, and again, indicated by these lines and spaces, but here we have none of that. And in the bone, you can even see that there's a cyst in the bone, which is often another radiographic sign of arthritis or evidence of arthritis. So we can see that this person certainly does have bone on bone arthritis at the base of the thumb, and that's what we're treating here with this surgery. So what we will do is I will take this bone out. That leaves a gap here. Then I will take a tendon from your wrist that is a wrist flexor, and you have multiple tendons that do similar functions, so you're not left with any deficit or anything like that. I take that tendon and I weave it through the bone and then roll it into a ball and place it in that space left by taking that bone out. This bone that we take out is called the trapezium. That allows for a little soft tissue spacer to take away that bone on bone arthritis, and now you're articulating against some soft tissue, and that helps with your pain. It works very well, and it's been around for a long time, and that's essentially what we're doing there with this surgery. So your incision is generally about like this over top of your thumb, and then you'll have a second smaller incision up here. I take this tendon here, and that's the one that we'll be using. Then I obviously do as I described on the x-ray here, and I roll that into a ball and place it in that area. So you'll have two small incisions. The stitches are usually absorbable after surgery, so not something that we have to take out in the office. So what can you expect with this surgery? I mean, this surgery is very good for pain relief. As I said before, it can take some time to get there, but the main reason for doing this is for pain relief. And then when you have pain relief, your function follows. So your strength typically will improve from prior to surgery, your function of the hand and use of it will improve, and certainly your pain will improve. Very rarely do we have a problem where this needs to be revised. You know, possible complications, you can get some numbness around the skin incision or over the back of your thumb. Infection with any surgery is always a risk. And it's important to know that it's not a normal hand that we're getting you back to, but for someone who has bad pain, they're very happy with this. It is not a surgery that you would do for any cosmetic reason. It doesn't change the arthritic look of the hand that sometimes the hand can take. It is, again, mainly for pain control and to also, therefore, improve your function. So I hope this video has helped your understanding and hopefully decreased any anxiety you have about going into surgery or how we're treating your shoulder. If you certainly have any questions that are left unanswered, please get them answered beforehand. We're more than happy to either have a phone conversation or if you want to come back into the office. But I do feel like the more you're educated, the less anxiety you'll have, and really the smoother the whole experience will go for you. So hopefully this helps. If you have any questions, please let us know.